Thank you for joining Pastor Isaac Crockett and me for part 2 of this 2-part program entitled When Truth Falls, Healthcare Fails, Lessons from COVID-19. And while this is a key theme, I had to mention that this program is special, not only because of the theme, but because of its timeliness and of that theme, but even more so. You may not realize it, but if you've been watching our program for any period of time, we've been on the air for now over 2 years. And believe it or not, this program right here marks the 100th Stand in the Gap program that Isaac and I have been privileged to bring to you since the launching of this program a little over 2 years ago. It's been our privilege to come into your homes all of this time. It's an honor, and I want you to know that. From Isaac and I, it is a privilege to be with you and in your home. And we believe that this is both a privilege, but we also sense a deep responsibility as we try to help bring truth into the homes of folks all across our nation, for the reason that people can better understand how to think biblically and how to make sense of the nonsense of all that's going on around us in our culture. We want to thank you for praying for us, and I'd like to ask you that you continue to do so. I want to also thank the management and the staff of WBPH Studios who make this program possible. It wouldn't be possible without them. And finally, I want to express my thankfulness to the Lord who has provided the strength and the safety for Isaac and me to come to you every week. And can I take just a minute at this time and ask you to consider dropping us a note, perhaps, of what this program has meant to you? Could I also encourage you to include perhaps a one-time gift of any amount to Stand in the Gap as a 100th program anniversary offering? And by so doing, thank the Lord. You can share and thank the Lord by doing that and helping us to move forward. We're in critical days, you know that. God has the American Pastors Network squarely in the middle of the fight for truth and freedom. And we need your prayers. We need your financial help. We'd love to hear from you this week. We'd love to be encouraged by you. And we'd love to provide the opportunity for you to sow into the kingdom and to help communicate truth in these very critical days. And the address will be on the end of the program. So you can do that and just watch. It'll tell you at the end. Well, last week on this program, we presented examples of how the citizens, the families, the businesses, and the churches of this nation are being harmed by COVID policies because the truth is not being told. The right questions are not being asked, and deceptive terms are being used, such as what constitutes a true COVID case, or, for instance, what is a true COVID death? And since masks do not work medically, even the World Health Organization says that, why are they being mandated as if they do? Today on part 2, we'll look more at the cause for this confusion, the cause for how we got here, and the best solutions if we are to keep health care freedom and integrity in America alive. I'd like to welcome back right now Twila Brase, President and co-founder of Citizens Council for Health Freedom. Welcome back, Twila.
Thanks so much, Sam. I'm really glad to be here.
Twila, I just mentioned a couple things that we dealt with last time, cases, deaths, and you talked before about not leveling as much as trying to eradicate a virus that is not possible. And frankly, the number of cases as they go up is not a problem, so don't be alarmed because the deaths and the hospitalizations are going down. But here's another issue that came into creating the panic and the fear that has impacted our nation, and that was on projections. I mean, we all recall what the numbers were, and here again, that's truth. Were we lied to? Was it we just didn't know? But talk to us about the projections, and are we, what do we think about those?
So the projections come from a variety of sources, but the big projection came out of England, and it was that 2.2 million Americans would die. And I think it was something like 600,000 Brits or 500,000 Brits, and it was never peer reviewed. Nobody could see the data as to where that came from, and it didn't take them too long after kind of an outcry of people who also know what they're doing with statistics for them to do a new modeling. They revised their modeling, and so they came down with, I think it was 200,000 Americans would die. And so, modeling, I think everybody needs to look askance at modeling. There are so many people out there with models, and models are only as good as the data and the assumptions you put into them, and you're putting into them things that you know nothing about. COVID-19 is a big mystery. It still is a mystery, and nobody knows anything about it. Coronavirus is not a mystery, but COVID-19 is a very mysterious coronavirus. And so you really have to, look at the model and then go, well, I don't know. Is that really true? I don't know. And as we know, it's not.
And there again, ladies and gentlemen, truth. We're talking about that. Modeling is just one area where truth and data and objective, measurable data has not been followed, not used, and of course, we become subjects of that faulty data and projection. When we come back, Isaac's going to talk with Twila, and we're going to learn just a little bit about how truth, though, not being taken out of medicine and health, didn't just happen with COVID-19. We'll give some other examples of that in just a moment.
Truth, flexible or permanent? The Bible, ancient history, or powerfully relevant? Culture, a reflection of enlightenment or warning signs? The pastor, commentator, or frontline combatant? Every day, American Pastors Network speaks to these questions where and when they matter. With hundreds of affiliate radio stations nationwide, a website and mobile app screening today's headlines through the twin lenses of the Bible and the Constitution, educating, informing, equipping. This is the American Pastors Network. The time is now to stand in the gap for truth.
Welcome back to Stand in the Gap. And again, today we're talking actually part 2 of a subject about what causes the healthcare system that we trust so much to fail. And we're looking at this idea that when truth falls, then our healthcare fails, and we can look at kind of this case study of the response to COVID-19. Our good friend and special guest with us today is Twila Brase, the president and co-founder of the Citizens Council for Health Freedom. And so Twila, in the book of Hosea, in the Old Testament, the prophet Hosea warns the people of Israel, and he says in Hosea chapter 4, verse 6, he says, "My people are destroyed for lack of knowledge." And it goes on, and God basically says to them, he says, you deny my truth, my knowledge, and I will deny you. I will reject you. And so we want to come to real truth and objective truth here. We need a standard. If we don't have knowledge, if we don't have truth, we don't have a standard. If we don't have a standard to go by, we don't really have anything. We don't have our freedom. And as in America, we are prone to want our freedom. We're a freedom-loving people, and we need to have standards. We need to have knowledge and truth. And so in simple terms right now, really, we have a lot of absence of truth, a lot of confusion, even people maybe purposefully twisting some of the facts or deceiving people for their own gain, and other people unknowingly being deceptive because they're taking numbers that they hear that may not be given in full context. And so I think most of our viewers realize that things just aren't quite right with what we hear with COVID-19. They keep, as you've said before, moving the goalpost on us. And so we know that's not right. But has this already been going on? You started the Citizens Council for Health Freedom quite a while back. And what has been happening in the area of healthcare? Is this the beginning of this, or have we already been involved with maybe deception or a lack of truth in healthcare for a while?
Yes, there's a lot of facts in healthcare that people don't understand, and so that means that they understand fiction, and they think of fiction as truth. And so let's just look at a few examples. So one of them is HIPAA, And people get handed the HIPAA privacy form at the doctor's office to sign, and they dutifully do it, thinking that it protects their medical privacy and their confidentiality. When, as a matter of fact, the only thing that that form does is say that you have read or understood the clinic's or the hospital's notice of privacy practices. If you have done so, then you know that you don't have any privacy. So HIPAA is not a privacy rule. It's not from a privacy law. It is really considered a permissive data disclosure rule. So all of this data can be shared widely, broadly, without patient consent, and that is what the public doesn't understand. Even our business with Congress doesn't understand that, but that's the truth, and that's a fact that most people don't know. And so they think that what they say is confidential, and it isn't. Or let's just look at managed care. People think of their health plans as though they were real insurance. Well, their health plans are not real insurance. In truth, they're considered prepaid health care, where you give them all this money and then they get to decide whether or not you can have access to care. Real insurance, the medical indemnity kind, simply pays the amount of money that they've determined up front. They don't get in the middle between you and your doctor. They're not there to tell you what to do. They're real insurance. They simply pay the bills to the extent that they've agreed to pay them. And so there are these kind of things happening, or even evidence-based medicine. That term, you shouldn't believe evidence-based medicine, because it's what outsiders have decided to call evidence, and they do studies, and even though there are things that show differently, they get tagged as evidence-based medicine, and then they tell doctors to practice that way, rather than looking at you as an individual and practicing the way you need to have medicine done with you. So yes, this is not the beginning, but there's lots of really big things happening in healthcare that have been happening for a long time that people don't know are not facts, but are actually fiction.
And Twila, I know that that's probably a shock to many people. I know the HIPAA rules and the lack of privacy that you cited, that's a real shock for people. But we're not stay on that. We're just trying to. You just identified two major areas where truth has been absent in healthcare, and people have bought into it, just not knowing. Now, let's go back to the COVID policies of today. Some of the things we've talked about, the efficacy of the mask, as an example, does not exist. It's more feeling than it certainly is fact, all right? Cases, many probable, not real, all that kind of thing. But the result of all of this, where medicine and ability to go to our doctors when things are coming up during these last months, and who knows how long this whole thing will last, there are other impacts that may be long-term that should be factored into this, that are not being looked at. Again, because truth has been taken out, now there are the consequences. We share a few of those consequences that you could think of or are witnessing that should help us to understand. We take truth out of healthcare in this case. There are consequences to it.
So consequences of looking at COVID-19 like, it's going to kill us all really has changed, our freedoms in this country today. The lockdowns, the fact that we can't get access to the care that we need. One doctor in a video talked about that he thinks that 50,000 people are going to die from cancer unnecessarily because they're not being seen, their tumors aren't being diagnosed, or their grade 2 tumor is going to move to an untreatable grade 3 tumor. And when you scare everybody to the degree that everybody is being scared, these are the kind of consequences. Or like HCQ, hydroxychloroquine. Lots of doctors are using this successfully. India is using it for all of their healthcare workers prophylactically. Countries that have malaria, where people take this all the time, have less COVID-19 than countries like America that doesn't, right? And yet the government got in the middle of that. State governments are getting in the middle of that and telling doctors that it's not, or that it's against the standard of practice, and they could have the licensing board come after them, or the pharmacies that are refusing to dispense the prescription when the doctor orders HCQ for a patient. This kind of idea that the pharmacy or the government can tell doctors how to practice when they have zero zero knowledge of that patient and zero responsibility for that patient, and they're not the ones skilled in that. This is a long-term ramification, a very dangerous ramification that we should all be very, very worried about.
All right, something to be worried about. Let's bring up the V word, vaccinations. And so many people are really putting a lot of faith and trust in this vaccination that's out there, but it hasn't become ready yet. And we're going to, make it somehow available faster than ever. Should we be worried about that? Should we be worried that maybe in this rush to push a vaccine out there for, in this particular case, a coronavirus, that is transmitted so easily, are we possibly skipping some of the things that we shouldn't be skipping? Are there things that we overlooked that they normally would go through this normal testing and time frame?
So I think the vaccine issue is critical and very interesting, right? Because a lot of people are saying, well, you're going to have to wear masks, which, the World Health Organization always says there's absolutely no evidence to say they work. You're going to have to wear masks until we find a vaccine. Well, from the very beginning, the experts were telling us that we probably wouldn't get a vaccine for 12 to 24 months, maybe even 4 years. Dr. Fauci on the White House coronavirus task force, he's saying that even if we get it, it might not work. And then even worse than that, it might backfire. And by backfire, that means that if you get the vaccine and then you get the virus, it might make the virus more virulent in you. This is not a virus that we want to have more virulent if we get it. And so there's all of this promises about a vaccine, but there's at least 30% of the population that won't ever get it. How long are you going to mask? An epidemiologist talks about the domino effect, where once you put something really stringent in place, you just keep going from one level of stringent to the next. And some people, like the head of this whole thing in Sweden, which did not lock down, they're like, how are these countries going to get out of this? Once they've locked down this tight, what's going to just suddenly let it all go? And I think, that's one of the dangers in vaccine is really big in that whole decision making. And I think, we might never get it. HIV, they've been trying for 36 years. There's no HIV vaccine, and that's a virus.
And so, Twila, not only vaccinations, as you're talking about it, may not happen if they come too quickly, even as the date we are recording this program with you right now. A potential expedited vaccine is coming down the road, and the experts, whoever they are, and we know we got a problem with the experts. You're an expert. You're a true expert. But many others are not. Actually said the same thing that you just said, that a premature vaccine that's not tested over a sufficient length of time could not only make it worse for the person who takes it, as exactly what you just said, but they also brought up the idea that if it is not done properly, this mutating virus called CV-19, you could actually cause it to mutate faster and make it worse, which then says, what in the world are we doing? But I want you to conclude, but I want you to talk on one other thing, because most of the vaccination talk that's being thrown out there also has with it tracing, which means the government's going to be tracking people. That scares me to death. I hate the thought of that. Speak a little bit about what that may do, and then I want to go back and ask you a final question.
Some people say that contact tracing, when it's done the right way, will go from the one confirmed case to 100 contacts. And then all of those contacts, particularly when we're looking now at not only confirmed cases, but probable cases, all of those contacts could be forced into quarantine. They want everybody to share all of their contacts, the names that they've been in contact with. And a lot of people are very uncomfortable with that, and particularly uncomfortable with that with being put in a government record in perpetuity, or having those people forced into quarantine when they really didn't get exposed enough to be sick, and they don't want to do that to their friends or their families or their colleagues. But also just look at what recently happened in Kentucky, where this one couple just decided to test themselves. I think they were going on a trip. So they just decided to test themselves to be sure that they were okay. Well, she gets found to have had coronavirus. And so they go to the house and they say, you know, we want you to self-quarantine. The woman is not having a problem with self-quarantine, but she's having a problem with the paperwork. Something about the paperwork. She didn't want to sign that. So they said, well, we're going to have to escalate this. So like 4 days later, they come with a whole bunch of government vehicles and a bunch of uniformed people, and they put electronic monitors on both their ankles. And so if they leave their home more than 200 feet from their home, they're reported and the police are going to come. And I think the paperwork she didn't want to sign had to do with the fact that they wanted the government to be called before she could go to the hospital. And she was like having none of that. Right. So this is the situation that we end up with contact tracing. And so we really encourage people to consider carefully whether or not you want to participate.
And again, ladies and gentlemen, this is all based on truth. The tracing, the vaccinations, all the things we're talking about. Medically, it is not valid. But again, if truth is thrown out, then healthcare, the integrity of the healthcare system, in fact, fails. That's what we need to try and avoid. We'll be back in just a moment.
Stand in the Gap is produced and recorded in the studios of WBPH Philadelphia. Positively different television.
Welcome back to Stand in the Gap. And as we kind of wrap things up right now with this program, we're going to ask our special guest, Twila Brase. Twila, could you just kind of take this theme again that we're talking about when truth falls, when we leave the truth behind, like Hosea chapter 4, verse 6, where we're destroyed because we don't have knowledge and truth. When we leave that behind, we see even our healthcare suffers, and particularly in a response to COVID-19. Could you just take the next 60 seconds here and kind of maybe give another summarize kind of what we've been talking about, or any kind of encouragement for our viewers in this regard?
So I would say do not follow the fear narrative, especially as a Christian. That is something you should really try not to do. Look at our Facebook Live videos so that you can find facts and then share them broadly so that your friends and colleagues do not have to live in fear either. Do protect yourself with distancing and hand washing, and particularly protect the vulnerable. Try to find a medical exemption or other exemption for the mask, because a lot of people are just having a hard time breathing and they recontaminate themselves. And then think carefully. Do you really want to get tested and maybe end up like that Kentucky couple? There's no need to test unless you're sick, and consider not doing the contact tracing. Okay. I think you just need to protect your family, right?
Okay, so you're basically saying the virus is real. It does affect some people in a serious way, but a small number of people, but also interpret what you hear. Because what we hear is a lot of deception and not a lot of truth designed to make us panic. Give us your website one more time, Twila.
Our website is www.cchfreedom.org. cchfreedom.org.
Thank you very much, Twila. Ladies and gentlemen, you can find that right on the screen, and I encourage you to really go there. Getting information is so critically important in helping to understand and support and defend your own family, make right decisions, whether you are a pastor of a church making decisions for your church, or a family for family gatherings, or school for school gathering. All of these things. Take this information. Knowledge is important. And again, as John 8:32 said, the truth shall set you free. Truth does give freedom, and that's what we want you to have. Well, thanks for watching us today again on Stand in the Gap. Been our privilege to be in your home, and we hope that this program, of which part 1 was last week, go to the website, listen to part 1, Part 2 together. I think you will have a superb handle on what is happening relative to healthcare and the COVID-19 policies and how you should approach that. And share it with 50 of your friends, 100 of your friends. Let them know, because truth does no good being bottled up. Communicate to us this week. Let us know that you have watched us, that you are watching us. Join with us in prayer. Join with us in partnering in finances. And join with us in our effort to communicate the truth and to stand in the gap for truth. That's what we ask you to do, and that's what we ask that you pray for us that we can continue to do.